My name is Forrester. I was trained as a chemical engineer, undergraduate training, and went to medical school at Georgetown. Did a 3-year family medicine residency at University of California, Davis in Sacramento, and went to work for the Permanente Medical Group in 1978 and worked there for 30+ years. During that time at Permanente, I took care of a panel of patients as a primary care doctor. I also had several positions of leadership, including Chief of Preventive Medicine and Chief of Patient Education in Sacramento. And then I ran a 36-person family medicine department. And then I helped build and run for 10 years a multi-specialty clinic with 65 physicians, an outpatient OR. Along the way, I became certified as a physician executive. And as part of my job as physician in charge at Rancho Cordova, we implemented a training program with doing total quality management, eliminating errors in medicine, and doing some innovative projects. So it was a very rewarding career. Toward the end of my time, I also became certified as a patient safety officer at Intermountain Healthcare. And I was practicing what I would consider pretty traditional medicine. Medicine had gotten a little bit more complex over the 30 years I was there. We had 2 drugs for hypertension when I first started, and I don't know how many we had when we finished, but we had a lot more classes of drugs to treat blood pressure for. In addition, the actual targets for treatment had been ratcheted down. We were treating blood pressure more aggressively. We had changed the definition of diabetes from a fasting sugar of 150, and it slowly worked its way down to 125, and had invented a new diagnosis of prediabetes between 100 and 125. So we were seeing a lot more chronic diseases. We were pushing a lot more medications. And I was writing a lot more prescriptions. And my wife and I had been vegetarian for about 9 or 10 years, and a friend gave us a copy of the China Study, and we read it. And my wife teaches philosophy at Sacramento City College, so she does animal rights and things like that. And so we both went plant-based at that point. And over a 3-month period, I personally lost about 5 or 6 pounds. My low-density cholesterol went from 124 to 94. My energy level went up. And I started recommending that book to patients, and I started finding that even patients who read the book would start changing what they wanted to do. About 3 months later, Neil Barnard was in town, the president for Physicians Committee of Responsible Medicine, and was doing a book tour for his book, Neil Barnard's program on reversing type 2 diabetes. And I read the book, and it was really soup to nuts. I mean, it really explained things well. It had menus, recipes, it explained the science. And I was in a very busy practice where I was seeing 26, 27, 28 patients a day, writing lots of prescriptions, not having a lot of time. The organization, I didn't have a good support system around me because the American Diabetic Association diet was being taught in all the classes. I was getting patients who had had cardiac procedures done who were coming back and who were being given the American Heart Association diet, but I was trying to teach the Ornish diet and Barnard's diet. And what I found was even just giving the patients the book, the patients that followed it, they were getting off medications. Their numbers were getting better. And not only were their numbers getting better in diabetes, but I was also reducing their blood pressure medicines and their statins for cholesterol. And it was a very rewarding way to practice. The interesting thing is that in the system I worked in, we had a computerized medical record system, and they had a diagnosis for diabetes, but they didn't have a diagnosis for status post-diabetes. So when a patient got cured of diabetes, I had to take them off my panel. And I actually tracked them. There's a health maintenance section, so I would put them down as diabetes cured on this day because they were on no medication and their sugars were normal and their hemoglobin A1Cs were normal. But actually, because I was being tracked as a clinician within the system, as most doctors are across the country, on the percentage of control numbers, being trained as a chemical engineer, I'm sort of interested in numbers and tracking a little bit, and as a trained patient safety officer, I follow results over time on control charts. It actually, by taking those people off your panel, you actually had worse control numbers. So in some respects, my patient care was getting better, but I was being evaluated poorly by the organization, and the organization was looking worse. So it was really a rewarding way to practice because I think I took more people off pills in the last 3 years of my practice than I put on pills for the 3 years before that. So I think what happened to me then is the doctors around me started asking me what I was doing. And at that point, I started giving them presentations on this. In giving the talks, people often ask me, why do your doctors not keep up with this stuff? And when you find people like Dr. Michael Greger with the Humane Society of the U.S., who reads all the human-based peer-reviewed scientific literature every year and reviews about 7,000 journal articles, and followed Dr. McDougall's newsletter, and he has an interesting hobby of reading all the medical treatment type literature. You sort of find the right people who can read the literature and synthesize it in a way that really makes a difference for individual patients. And that was something that I stumbled on maybe later than I should have in my practice, but at least I stumbled on it at one point. So I think one of the advice I would give to physicians is that they find people like Dr. McDougall or Dr. Greger or trained non-physicians who are very helpful, like Jeff Novick and Doug Lyle, to actually and be associated with nonprofit organizations like maybe PCRM and Dr. Barnard, who was really instrumental in getting me onto this path. They do some very good work. So practicing clinicians should sort of start following the right people and doing the right things in their practice. And I think they'll have a much more rewarding practice in medicine, because it's much more rewarding, as Dr. McDougall says, to see your patients continually getting better and taking them off medicine. And the patients appreciate that from a service perspective. I just wrote an article called A Path to World-Class Service for Medical Organizations, and patients really don't want to be on pills. They really want health. They don't want disease management. And I think medicine is charged off into what I call tertiary prevention. It's not my definition, but I think we lose track of that sometimes. Primary prevention is preventing diseases. Secondary prevention is curing chronic diseases that you have. And tertiary prevention is just controlling complications. So that's basically being on medication, because as far as I'm concerned, nobody that's on a chronic medication is actually cured, because they're still on the medication. And we confuse the terms. Statins are called primary preventive agents. They're not primary prevention, they're tertiary prevention. And all these drugs are only evaluated over short term. And when you start looking at some of the complications you get with statins and the few patient papers that are out there over long-term complications, it's really pretty daunting as far as how bad these drugs are over time. One of the advantages of having some practical wisdom of being in practice for so long is that you've had the opportunity of seeing the latest drug come out, and then 2 years later they find out the complications and we're scurrying around to take them off. So it's, with that practical wisdom, I think we need to do the first do no harm and see if we can treat people without actually putting them on drugs first. And for people who are on drugs, I think one of the things that Dr. McDougall has taught me, that when you start managing people that are on drugs, you really have to be very careful about changing their diet radically, because you can get them in trouble pretty quickly, which is the downside. But the upside is you can get them off the medications a lot faster than most doctors would believe possible, I think. So the doctors are sort of trapped in sort of a treadmill of that's sort of a product of the environment that they practice in. And I think if they can get the right information and start practicing, then their life will be better, their family's life will be better, their community around them will be better, and the organizations they work for will be better. It's a tough road. I sometimes wonder how Dr. McDougall has, over 30 years, continued to fight this battle, but we need people out there who are like product champions, who actually keep pushing this. So whenever we get to what's called now the tipping point, where we actually start seeing an acceleration in the correct direction that medicine needs to go in, it actually isn't the tipping point, it's actually the paradigm shift, which is Kuhn's book, The Structure of the Scientific Revolution, which was probably the most cited scientific publication in the 20th century. So we get to when enough evidence is built up that people get it, and all of a sudden the paradigm shifts and we start moving toward primary and secondary prevention. Now, I would like to live long enough to see that happen.